Assalamu alaikum dear students, welcome to your channel The Anatomy Canvas. In today's class of embryology, general embryology, we are going to discuss with the MCQs with their answers and explanations, and these all MCQs are taken from the internal examinations of different medical colleges. So first MCQ for today's class is that the part of the sperm containing proteolytic enzyme to digest zona pellucida is, so there are different parts of the sperm, that is maybe corona, head, acrosome, cumulus, capacitator. So answer to the question is that the acrosome is the part of the sperm which contains proteolytic enzyme to digest the zona pellucida. Next MCQ is that the 7 days blastocyst has all of the following except: it has a single layer of the trophoblast at embryonic pole. It is surrounded by degenerating zona pellucida. It is attached to endometrial epithelium and has a blastocystic cavity. So please remember, as it is a blastocyst, so it has a blastocystic cavity, and at the 7th day it has started to attach to the endometrium, and at the same time the zona pellucida has started to degenerate and disappear. The only option left is the single layer of the trophoblast at embryonic pole, because this is not the single layer, multiple layer forming inner cell mass and outer cell mass. So A is the incorrect option and answer to this question. Next question is 26-year-old para 2 presented with history of 5 weeks of amenorrhea and irregular vaginal bleeding and abdominal pain with positive pregnancy test. Ultrasonography reveals ectopic pregnancy. So most common site for the ectopic pregnancy is either in the cervix, that is the internal os of uterus, mesentery, ovaries, or uterine tube. So these all are the sites where ectopic pregnancy can take place, but most commonest site is the uterine tube. So this is the correct option. Next question is the bilaminar germ disc consists of mesoblast and hypoblast, forms embryo proper. It is derived from the outer cells of the morula, is formed at 4th week of development and synthesizes HCG. So this bilaminar germ disc is formed of the hypoblast and the epiblast. There is no mesoblast. It forms embryo proper, yes. Is derived from outer cells of the morula, no. It is formed from the inner cell mass of the morula. It is formed at 3rd week of development, and it do not synthesize HCG. The HCG is synthesized by the trophoblast. So B is the correct option. Next MCQ is ovulated oocyst is arrested at anaphase of the meiosis 2, metaphase of meiosis 1, metaphase of meiosis 2, prophase of meiosis 1, prophase of the meiosis 2. So always remember, the ovulated oocyst is always arrested at metaphase of meiosis 2. It completes its first meiotic division and at the time of ovulation, and then its second meiotic division is arrested at metaphase. Next MCQ is a 30-year-old gravida 3 para 2 at 24th week of the pregnancy with history of the previous 2 cesarean section, presented with per-vaginal heavy painless bleeding. This painless is also very important point. On examination point, she has feeble pulse with hypotension and positive fetal heart sound. Again, look at this, baby is alive. So most probable diagnosis is, there are different options. Ectopic pregnancy do not lead to 24 weeks. It usually aborts at 5 to 6 weeks. Abruptio placentae is condition in which placenta is torn and the patient present with the severe pain and shock, and in this condition patient has the painless bleeding. Placenta previa is a condition when there is a low-lying placenta and it leads to the painless bleeding. Miscarriage is condition in first week of the first trimester of pregnancy, and intrauterine death is not possible because there are the positive fetal heart sound. So correct option is the placenta previa, which is a low-lying placenta with the painless bleeding, and this painless bleeding leads to hypovolemic shock. Next is a newborn baby was brought to the pediatric OPD with the abnormality in development of the lower limbs, the urogenital sinus, and the lumbosacral vertebrae. So most probable diagnosis is that is holoprosencephaly, the caudal dysgenesis syndrome, the sacrococcygeal teratoma, and situs inversus. So please resemble holoprosencephaly is the abnormality, is the prosencephalon, that is the forebrain. The caudal dysgenesis syndrome is a condition in which the mesoderm is not added by the primitive streak to form the caudal areas, that is the lower limb, the urogenital system, and the lumbosacral vertebra. Sacrococcygeal teratoma is a remnant of the primitive streak, and situs inversus is a condition in which the different organs are not present at their normal site and they are present on their opposite side, like appendix on the left side and heart on the right side, etc. So in this condition, the answer is the caudal dysgenesis syndrome. Next MCQ is, which of the following is responsible for ventralizing the ectoderm and mesoderm, causing induction of the neural plate? So please remember, when neural plate will be when ectoderm will be ventralized, it will form neural plate, and when ectoderm will be dorsalized, it will form the mesoderm. So different factors are responsible for this, that is bone morphogenetic protein, the transforming growth factor beta, folic acid, fibroblast growth factor, transforming growth factor alpha. So correct answer to this question is transforming growth factor beta, which is responsible for ventralizing the ectoderm to form the neural plate. Next MCQ is, embryonic age can be estimated at an early stage by counting the number of the somites. So first pair of somite arises in occipital region at approximately either day 18, 20, 21, 22, 24. So very straightforward and simple question, that the embryonic age is estimated by first pair of somite at day 20, and it is the correct answer. Next MCQ is, total length of pregnancy is considered to be dash after onset of the last normal menstrual period. So there are different days, that is either 259 days or 37 weeks, 266 days or 38 weeks, 273 days or 39 weeks, and 280 days or 40 weeks. So it is from the onset of the last menstrual period. So correct option is 280 days or 40 weeks. So D option is correct. Next MCQ is, embryonic period or period of organogenesis occurs from 3rd to 8th week, from 3rd to 9th week, from 4th to 8th week, from 4th to 9th week, or first trimester. So please always remember, the period of organogenesis is 3rd to 8th week, and this is the correct option. Factors responsible for ventralizing the ectoderm and mesoderm to form neural plate. So the stem has now been little bit changed. The factor which is responsible, first we were looking at the factor which was responsible for ventralizing the ectoderm, and now another factor which is responsible for mesoderm to form the ectoderm to form the neural plate. So different factors over here are written, that is upregulation of the BMP4, that is bone morphogenetic protein, the upregulation of the fibroblast growth factor, downregulation of caudin and noggin, the downregulation of the W and T factor, and downregulation of the fibroblast growth factor A. So this is the BMP4, and its upregulation leads to formation of the neural tube. During implantation, the blastocyst implants in the endometrium, usually attached to the endometrial epithelium at its abembryonic pole, usually implants in inferior wall of the body of the uterus, causes changes in the myometrial tissue. So a correct answer is that it implants in the endometrium, because it attaches that embryonic pole. Usually it is attached to the upper part of the body of the uterus, that is usually it is implants at the fundus, and it do not causes any changes in the myometrium. So correct option to this question is A. Next MCQ is, primitive streak is derived from the outer cells of the morula, is formed during the second week of development, persists as cloacal membrane is the site of the involution of epiblast to form the mesoderm and persists as oropharyngeal membrane. So you all know that it is not derived from outer cell mass of morula, rather it is from the inner cell mass, that is the bilaminar germ disc, and the epiblast which is forming the primitive streak. Second, it is formed in the third week of development, not forming the cloaca or the oropharyngeal membrane. So correct option is the site of the involution of the epiblastic cells to form the mesoblast. Next question is most important region of the decidua for the nourishment of the conceptus is, that is frondosum, capsularis, spiritalis, bizalis and leaf. So please remember that the decidua is either decidua bizalis or decidua paritalis or decidua capsularis. So decidua bizalis is the site which is responsible for the implantation of the and nutrition of the conceptus, and this is the correct option. The frondosum and the leaf are basically parts of the chorion, and these are the called chorionic frondosum or chorionic leaf. Next MCQ is intraembryonic mesocoelom located cranial to the oropharyngeal membranes becomes the oral cavity, the cranial foregut, the stomodium, the pericardial cavity, nasal cavity. So correct option is the stomodium. This is the C option and it is correct. Next MCQ is a 5-month-old baby boy presented to medical OPD with growth retardation. On examination, the baby has upward slanting eyes with epicanthal fold and single palmar crease and hypotonia. So, the most probable diagnosis can be Down syndrome, can be Klinefelter syndrome, trisomy 13, 18 or the Turner syndrome. So, please remember the typical point, that is upward slanting eyes, epicanthal fold, single palmar crease and hypotonia. These are the signs of the Down syndrome, and this is the correct option. Next MCQ is chromosomal abnormality that causes a woman to be unusually short in stature, to have a webbed neck and generally lack secondary sexual characteristics. So these all are very typical signs and symptoms of the Turner syndrome, and this is the correct option. 35-year-old female presented to gynae OPD for the treatment of the primary infertility. Which of the hormone is responsible for release of dominant follicle from the ovary? So it may be estrogen, it may be FSH, HCG, LH and progesterone. So you all know very well that it is the luteinizing hormone which is responsible for release of the dominant follicle from the ovary. Next MCQ is by middle of the third week, intraembryonic mesoderm separates the ectoderm and endoderm everywhere except, and that is at oropharyngeal membrane cranially, that is cloacal membrane, in median plane cranial to primitive node where cardiogenic area is present, in medial plane cranial to primitive node where notochordal process is present, and none of the above. So it is present at the oropharyngeal membrane. This is the endoderm and ectoderm are present. There is no intervening mesoderm. Similar is the condition at the cloacal membrane, and also it is the condition where the in between ectoderm and endoderm where notochord is present. So the answer to this question is C, which is an incorrect option. Next MCQ is the pregnancy tests generally are based on detection in the maternal urine of the estrogen, the human chorionic corticotropin, human chorionic gonadotropin, human chorionic somatomamotropin or progesterone. So answer to this question is the HCG, that is human chorionic gonadotropin hormone. Next question is arrested prophase of the primary oocyte is produced by the androgen, estrogen, human chorionic gonadotropin, the oocyte maturation inhibiting factor, and the progesterone. So this is the OMI which is responsible for the arrest of the prophase of the primary oocyte before pregnancy and before puberty, and after the puberty this primary oocyte are selected by the FSH, they are recruited, and then they started to grow. So correct option is the oocyte maturation inhibiting factor. Next is, which of the following is not a derivative of the neural crest cell? That is adrenal cortex, adrenal medulla, or glial cells, odontoblast, or Schwann cells. So a little bit tricky question. The adrenal medulla is derived from the neural crest and not the cortex. So adrenal cortex is not a derivative. All others are the derivatives of the neural crest cell. So correct option for this question is adrenal cortex. Next is, during development, the notochordal process arises from involution of the endodermal cells. No. Becomes appendicular structure, skeleton. No. It completely degenerates. No. It persists as nucleus pulposus. It extends from the precaudal plate to the primitive node and is involved in the induction of the primitive gut. No, it is not involved in induction of the primitive gut. The correct option is that it extends from precaudal plate to the primitive node. So correct option is D. Hemolytic disease of the newborn baby is caused by an increase in number of erythrocytes in newborn. No. The Rh incompatibility between Rh negative mother and her Rh positive baby, or Rh incompatibility between Rh positive mother and Rh negative baby. Loss of the blood by the fetus, malfunctioning of the thymus during fetal development. So correct option is Rh. When mother is Rh negative, she do not have the antibodies, and when baby is Rh positive, her antigens crosses the placenta, enter into maternal blood, produces antigen antibody response. These antibodies then again re-enter into fetal blood and causes the erythroblastosis fetalis. So correct option is B. At approximately end of third month, the structure which are present in umbilical ring are the canal connecting the intraembryonic and extraembryonic cavities, connecting stalk, the umbilical vessels with wart and jelly, vitelline duct, all of above. So these all are present at third month of development in the umbilical ring, and E is the correct option. Next is the 7-day blastocyst has all of the following except: has a single layer of the trophoblast at embryonic pole, has an blastocyst cavity, is attached to endometrial epithelium, and is surrounded by the degenerating zona pellucida. So correct option is that it has a single layer of the trophoblast at embryonic pole. This is actually incorrect option. So we are finding the except. So this is the answer to question. Total length of pregnancy is considered to be dash after onset of last normal menstrual period. So this is 280 days or the 40 weeks, and this is a repeat question. So option D is correct. Next MCQ is, neural tube formed during development has two openings. What day after conception does its cranial neuropore closes? So that is day 27 after conception, day 25, 14, 7 or 5th day. And correct option is 25th day after conception when cranial neuropore is closes, and 27 day when caudal neuropore. So here the answer is B. After fertilization has occurred within uterine tube, when does the blastocyst begins implantation? So this may be within minutes, after by 12 hours, by day 1, by day 2 or by day 7. So implantation begins at the day 7. Where does implantation of the blastocyst normally occur in female reproductive system? That may be the functional layer of the cervix, functional layer of the endometrium, also called stratum functional layer of the endometrium, also called stratum basal, myometrium or perimetrium. So this is the functional layer of the endometrium where usually implantation take place, and this is the correct option. So which part of the mature sperm contain lysosomal enzyme that play an important role in penetration of ovum during fertilization? That is maybe nucleus, maybe mitochondria, maybe acrosomal cap, centriole, or the flagellum. So correct option is the acrosomal cap. Next MCQ is which structure is derived from the same embryonic primordium as dorsal root ganglia? So gonads, kidney, pineal gland, liver, and adrenal medulla. This is a little bit tricky question. So you must know that the dorsal root ganglia is derived from the from the neural crest cells, and here the adrenal medulla is also derived from the neural crest cell. So this is the correct option. For a woman, usually first indication that she is pregnant and she has missed her menstrual period. In which week of the embryonic development will a woman become conscious of her missed menstrual period? So either start of third, fourth, fifth, eighth, or end of the 8th week. So please remember the ovulation takes place usually at 14 to 15 day of normal 28-day cycle. So in a normal cycle of 28 days, 2 weeks she has passed when she doesn't miss her cycle, and at the start of the 3rd week when she missed her cycle, she comes to know that she might be pregnant. So this is the correct option. Couple is trying to conceive a child following intercourse. Which of the following is responsible for prevention of the polyspermy? That is resumption of first meiotic division, the resumption of the second meiotic division, capacitation, sooner reaction, and release of enzyme from sperm acrosome. Please remember, zona reaction is responsible for the changes in the zona pellucida to prevent the polyspermy, and this is the answer to the question. Next is a pregnant lady doctor who works in radiology department is worried about effects of the ionizing radiation on her baby. So which of the following period the fetus is more prone to have effects? That is fertilization to end of first week, second week, third to eighth, third month to fetal life, or third trimester of the fetal life. So please remember, 3rd to 8th week is basically the period of organogenesis, and fetus is more vulnerable to having effects by the ionizing radiation during this time. So this is the answer to the question. Sacrococcygeal teratoma is the remnant of hypoblast, notochord, precaudal plate, primitive streak, or primitive node. So this is the remnant of the primitive streak, and this is correct option. Spina bifida can be due to deficiency of the which of the following? Very important point clinically. It may be vitamin A, B1, B12, C, or folic acid. So this is folic acid which is responsible for any type. Its deficiency is responsible for any type of the neural tube defects, including the spina bifida. So if there is deficiency of folic acid, it can lead to spina bifida. Next is the topic of the discussion during and the SGD session was first week of development. The facilitator asked the student that morula is comprised of how many cells during cleavage. A very simple question, maybe 2 cell, 4 cell, 8 cell, 16 or 64. So we know all that morula composed of 16 to 32 cell. So here 16 cell is given, so this is the correct option. Next is 35-year-old female present to OPD with a history of the oral contraceptive pills for the last 2 years. Now she wants to conceive. Which of the following hormone is responsible for suppression of ovulation by acting on hypothalamus and pituitary? That may be progesterone, estrogen, HCG, HPL, and androsterone. So this is basically progesterone, which is responsible for suppression of ovulation by acting on hypothalamus and pituitary, and this is the correct option. Next MCQ is which of the following is a not a derivative of the neural crest cell? That is Schwann cell, odontoblast, adrenal medulla, adrenal cortex, all glial cells. Again a little bit repeat question. This is adrenal cortex, which is not derived from the neural crest cell. Next is a prenatal diagnosis at 16 week of pregnancy can be performed using all of the following except the amniotic fluid, maternal blood, chorionic villus sampling, fetal blood sampling. So remember, amniotic fluid testing can be done after 12 weeks. So it is easy to perform at 16 weeks. Maternal blood testing can be done in the second trimester at any time. Chorionic villus sampling can be done after 12 weeks. This is the fetal blood sampling, which is done after 18 week of pregnancy. So it is not possible to do fetal blood sampling at 16 weeks, and this is the correct option. Next is the 25-year-old prima gravida at 30th week gestation presented at emergency department with history of dyspnea and excessive weight gain. On examination, the abdominal girth revealed term pregnancy with excessive amount of the amniotic fluid. When amniotic fluid exceeds 2 liters, condition is called the oligohydramnios, the polyhydramnios, hydrogravida or bag of the water. So this is basically polyhydramnios when there is excessive amniotic fluid is present, and this is the answer to the question. This is all for the today's class. Thank you very much, dear students, for your attention, and Allah Hafiz till next class, and best of luck for your professional exam.